Second, Japan, Dr. Kashima Masayuki. Dr. Masayuki is Japanese Society of International Medicine certified physician and general international medicine specialist. He is also Japan Oriental Medical Society Chinese medicine specialist. Dr. Masayuki's presentation title is interesting. It's the Kampo strategy to make COVID-19 just a cold.
Nice to meet you, everyone. I'm Dr. Masayuki Kashima. So, firstly, I thank you, Naona, very much for my opportunity of this lecture, and will express my gratitude and I would like to start my presentation. The battle against the pandemic of COVID-19 is a total war of humankind. The history of East Asian traditional medicine is the history of the first fight against epidemics, and there is no doubt that there is a big point in how to deal with this disease in this medicine. This figure shows the clinical course of COVID-19. The disease has a variety of symptoms, but the course is relatively uniform. 80% of patients have mild colds and recover spontaneously if they do not get worse in about 1 week. 20% of patients exacerbated in 7 to 10 days and develop symptoms of pneumonia, so-called first drip. Approximately 5% of patients become severe and require the treatment in intensive care unit 10 to 40 days after onset. What you can see from this is for most people, COVID-19 is just cold. If it can be ended with just a cold without somehow aggravating in humankind can win this battle against COVID-19. In addition, the characteristics that the symptoms progress slowly and the symptoms remain for a long time in consider to characteristic of dampness pathogen. In Kampo, early symptoms are considered important in diagnosis type of infectious disease. COVID-19 does not have a strong chill and fast, so it does not apply to cold damage. COVID-19 does not have strong sore throat or high fever from the beginning, so it does not apply to warm disorder. It is just cold. We need game changer of COVID-19 pandemic. Game changer should end COVID-19 with a mere cold without aggravated it. Candidate drugs now used as mild cold drugs. The prescription have a history that were once developed for the severe endemic of dampness pathogen. For example, Kakonto group, Jinsoin, Kososan. Candidate drugs, especially future prescriptions. In Japan, extract preparations are frequently used, especially for acute disease. It is easy to obtain and use, so I would like to list candidates from these. Kakonto plus Shosaikoto, the Saibokto are Japanese original combination prescriptions. Saikanto also is the most used only in Japan. The origin of Kakonto plus Shosaikoto is a Saikazu Gekito of Asada style. Kakonto plus Babreli radix, bical skull cap, pinel tuba, Gibsons. This prescription was passed on the great Kampo master Sohag Asada's family. Some records show the prescription was highly effective for viral pneumonia in Spanish flu. In 2020 winter, acute upper respiratory tract infection, there is a big problem. That is a differentiation between COVID-19 and other viral diseases such as influenza is difficult from the symptom. This strategy is developed to bundle both COVID-19 and other upper respiratory tract infection. The prescription with a yellow shadow is expected prescription for COVID-19. In the second stage, Cybocto mainly used. Use of Kampo prescriptions for at least 7 days, including the first stage. According to Japanese definition, it is moderate when oxygen is administered and severe when the ventilator is attached. Based on Gokoto and Saikanto for moderate or severe case, if patient has chest pain, change Saikanto to Shosaikoto to Saikanto, result in the combination of Gokoto, Saikanto, Hangekobokto. If patients have abdominal symptoms such as diarrhea, change Hangekobokto to Jinsoin, result in Gokoto, Shosaikoto, plus Jinsoin. Use saffron together if there is a rapid decrease in oxygen or if there is sign of the blood stasis such as dark tan. Start is supply C relatively early phase. By the Hochu Ekito. In recovery period, through the T and blood deficiency, blood stasis, flame in heart and lung, Ninjin Yoeito to supplement the T and blood, saffron to remove the blood stasis, Chikujo Untanto to remove the phlegm. Saffron So various effects can be expected from saffron. So saffron can exclude blood sources, cooling blood fever, detoxifications. And so saffron can treat it encephalitis and delirium caused by infectious disease from Compendium of Materia Medica. And recently, studies shows that saffron has an antidepressant effect. So COVID-19 patients are different, separate from the social distance. So many patients are in the depressant status, so effective for saffron. Saffron is a good product from Japan. I would like to introduce some typical case. For first case, 50-year-old female chief confirmed the fever, close contact with COVID-19 patients. She was asymptomatic in the morning of day of onset, negative in the first polymerase chain reaction test. On the same day, around 50 o'clock, she became aware of fever and subject to feeling of the heat and feeling the warmness in the limbs. The next day, that day is the first visit to my hospital, day 2. So she had a fever of 38.5 degree from the morning and visit to our hospital. Past his is nothing particular. Present illness, no cough, no runny nose, no nasal discharge, no dysgeusia, mild thirst, appetite loss, no diarrhea, no nausea, no back pain, no sore throat, no sweating. Height was 155 centimeter. Weight was 65 kilogram. Tongue examination quite cold. Laboratory test revealed so almost all normal, but it's a slightly high D dimer. That is a risk factor of COVID-19 is worsening. And so CRP, C-reactive proteins, slightly high, 1.08 milligram per deciliter. There was no airway symptoms such as a cough, but computed tomography shows a pneumonia. It's a typical viral pneumonia. This figure, the clinical course. After taking first stage Kampo prescription, her symptoms improved and C-reactive protein improved. When the second PCR was positive and she was admitted to another hospital and discontinued Kampo prescription, her fever and inflammatory response worsened again. Pneumonia on the computed tomography is also exacerbated by discontinuations of Kampo prescription. This case was exacerbated by stopped Kampo, so it is considered that the case did not improve naturally and was improved by Kampo. This figure is a computed tomography shows time course to the worsening in the viral pneumonia. Second case, 53-year-old female, her chief complaints, fever and cough. History of present illness, pharyngitis and cough appeared in the evening 3 days before the visit. Heat of 3.6 degree appears as a night from 2 days before the visit to the day before. There was a serum, the fever was 38.9 degree. On the day of her visit, she visited a nearby doctor and was suspected of having pneumonia on the chest X-ray examination, and was urgently transported to our hospital. The day after the visit, diagnosis was COVID-19 by PCR, and the Kampo A was started on day 2. After that, she was transferred to another hospital, but she was admitted to our hospital again due to exacerbation of symptoms on day 6. Past history, she suffered a systematic lupus erythematodes, maintenance prednisone 2 milligram per day. First visit our hospital's laboratory tested shows lymphocytopenia, liver injury, and so C-reactive protein 8.12 milligram per day per deciliter. First day's X-ray examination, chest X-ray, so patchy shadow right upper lung lobe, and computed tomography, granular opacity, and so atelectasis of bilateral lung. This X-ray examination, second time admit to my hospital. So X-ray examination, bilaterally filtrations of X-rays are so worsening, and computed tomography bilaterally ground glass opacity. So that's a suspected that so severe viral pneumonia. This figure, her clinical course. Small amount Kampo prescription could not suppress the aggravation. Symptom and fever and CRP improves promptly with increased dose Kampo prescription, Kampo B. Prednisone continued to be maintained 2 milligram. When treated contractly to strategy was performed on the way. So Kampo prescription Kampo C and the Kampo D, fever and CRP worsened and oxygenation also worsened. When I returned to the prescription according to the strategy again, Kampo E, the fever disappeared quickly, the inflammation reaction improved, and the oxygenation also improved. It is used in some cases other than these cases, and it has been used in combination with modern medical anti-inflammatory therapy and antiviral agent for severe ill patients. A list of composition of Kampo drugs used during the course. Kampo A is a low dose. Kampo B is a high effective. And the Kampo D and E is against the strategies component, but the Kampo D is against the strategy, but the Kampo E and F, so very good effect. So conclusion. Kampo can have the effect of ending COVID-19 as just a cold. Kampo can also treat the affective of COVID-19. Scientific verification is required, and the Japan Society of Oriental Medicine is engaged in various activities, such as observation study and randomized control trial studies. Thank you for attention.